We're about to do an abdominoplasty or tummy tuck, and I want to give you the secrets to what makes an amazing result. Hi, my name is Desai. I'm a board-certified plastic surgeon here with Florida Plastic Surgery Group. We have an abdominoplasty or tummy tuck today, and I want to just talk a little bit about the aesthetic refinements of what really makes a good tummy tuck result. Obviously, we're trying to remove the excess skin and fat from the belly button down to the mons pubic region. And we try to tighten the muscles, and we do that with 2 layers of sutures. But there's so much more to that that really makes a great aesthetic outcome. So in addition to removing that excess skin and fat from the lower abdomen and correcting the rectus diastasis, which is the separation of muscles, the aesthetic refinements for an abdominoplasty that really make what is an average result a 10 out of 10 or an excellent result is really scar position, the belly button, how the mons is addressed, and even correction of the rectus diastasis that may not be readily apparent, and I'll explain all of those things. So scar position is one of the keys. Keeping that horizontal or transverse scar low is really one of the aesthetic refinements of an abdominoplasty. If it's too high, it looks operated and cannot hide in a bikini line. That scar should be about 5 to 6 centimeters above the start of the genitalia and should have a gentle curve upward just above the thigh crease. Many times I see a scar that reaches up high, then comes back down low, and we don't want any frowny faces. No, that's no good. The other thing that really needs to be addressed is the mons. That mons oftentimes is low and needs to be elevated for patients that have lost a lot of weight. And for some patients, there's some bulk there. And so taking that bulk down and defatting that mons really creates the better aesthetic outcome. And many people leave that unaddressed, and it should be addressed in every tummy tuck. The belly button is one of the hallmarks. That's something everybody sees, even in a bikini. And there should be a natural depression that occurs as the skin comes down to the belly button. I've seen way too many times too much skin being left alone, the belly button being too low or too high. There's an exact point where that belly button needs to be, and there needs to be enough length between the belly button and the scar, because when that lower abdomen is elongated, it creates a much better aesthetic outcome. If that belly button and scar right next to each other, it looks terrible. Oftentimes we can do abdominoplasties without drains, and that creates a much better outcome. We do nerve blocks to minimize post-operative discomfort, and many of our patients don't have to take any narcotics. So that can really enhance the post-operative experience. And liposuction is a really good adjunct, even for smaller patients. It can create highlights or shadows where we can define the abdominal musculature and help create better contours in the flanks to try to give that patient a really snatched look. And oftentimes we'll see that even after you tighten the muscle up and down the abdominal wall, you have to tighten sometimes in a horizontal direction too to really get that flat look. And so we want to create the best outcome where the patient has no excess skin and as lean as possible.